Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Mary Henkel, who is my partner at Family Practice Associates. Welcome.
Thank you. Welcome.
Now, I said COVID, flu, RSV, still all out there, okay? But how do you know which one you've got?
Well, the cold is going to be less of a sentence than COVID or flu or RSV. So with the cold, you're less likely to have a high fever, and you're less likely to have significant muscle aches, and likely you wouldn't be short of breath.
Okay, so you're not necessarily, like early in COVID, we lost smell and taste. That's not necessarily the same anymore.
It's not. So there's a lot of different symptoms that can go along with COVID. And one of the main things to think about is if you are sick and you're at home, you want to test yourself. That's the smartest thing to do. And you can't test yourself too soon once you start having symptoms. But if you're negative, you want to repeat the test in 48 hours. So you want to do that at least twice, sometimes 3 times if you have symptoms. You want to prove whether or not you have COVID.
Now, you mentioned testing, and if people end up at the doctor, that's one thing you can test for all 3 of those things, correct?
Yes.
And does it make a difference if you have COVID or flu, or how you treat it, what you do with it?
It does. So if you can get a diagnosis, the correct diagnosis, a provider can offer Tamiflu for the flu per se, okay. And as everyone knows, Paxlovid for COVID. There's another medicine for COVID also. And then you also want to distinguish whether or not you could possibly even have strep throat, which of course you would take an antibiotic for, since that's a bacterial source of infection.
So all of those things, treatment is different, and you need to see your doctor to figure out which one is the right. But not everybody needs to see the doctor with the symptoms?
And not everybody needs to see the doctor. The people that should see the doctor are people that are older, over 65. If you have underlying issues, asthma, COPD, diabetes, hypertension, because those are the patients that if they are positive, they're going to be the ones that you want to give Paxlovid to. Not everyone needs Paxlovid.
And you have to pay attention with Paxlovid because it can be a problem with mixing with other medicines.
Yes, yes. And for instance, a statin drug for cholesterol.
Yeah, and you can stop that because the statin's not going to stop, and that's not going to kill you right away.
Right.
But a blood pressure medicine might be different. So you need to pay attention to what medicines you're on if you're going to take Paxlovid.
Right. And fortunately, with the computer system, it runs a check on drug interactions. And that's probably one of the most helpful things with the EMR and prescribing those meds.
So for all these things we just talked about, are there things you can do so you don't end up catching it?
We've learned a lot in the past 3 years. So distancing yourself, good hand washing, getting vaccinated. A vaccination for the flu can prevent 40 to 60% of flu.
Okay, and are there different types of flu vaccines?
There's a high dose vaccine for over 65, and then the regular flu vaccine.
Okay, different types of COVID vaccines we've seen change over the years.
Yes, and different companies making those.
Okay. Now we talked about flu vaccine, we've talked about COVID, there's also an RSV vaccine.
Yes, so RSV is something more new for the older population. So the way I see it, if you're 60 and over, you should be getting an RSV vaccine, a COVID vaccine, and a flu vaccine. And there's you can get all of those vaccines in the same visit. And it's most important to give all those vaccines in the same visit if someone's elderly and less likely to follow up.
Okay, now if you catch one of these diseases and you end up seeing a doctor and they progress, there's other things that can occur secondarily to the virus itself that could cause troubles.
Yes, so if you have COVID and you're still coughing, you're bringing up significant phlegm over more than 2 weeks, that would be a good reason to go to the doctor. You may have acquired a secondary bronchitis or possibly pneumonia.
And that might make a change in how you treat, because the pneumonia can be caused by COVID or secondary bacteria.
Exactly. Yes.
Okay. Anything else? Mask. Let's talk a little bit about mask. That's still important or not as important?
I'm partial. I wear a mask at work. It may not prevent everything, but I know in my mind that it likely prevents strep. I mean, the bacteria is going to be a larger particle, but I recommend wearing a mask if you're in a vulnerable situation, for sure. Like if you're going to the grocery and if it's rampant in your community, wear a mask.
Yeah. Well, you know, I'm a little bit paranoid because I had a bad spell with it, and I wear a mask anytime in a crowded environment. I still think it helps too.
Yeah.
Well, thanks for coming in. Appreciate all you do.
No problem.
All right. We'll be right back.